Next one. Okay, thank you very much. I'm the third speaker, but also the last speaker, right? So you're getting near the end here. We're going to take a look at a little bigger picture. We're looking at the viruses. That's about as small a picture as you can look at. I'm going to look at the global response to the Ebola epidemic, and as has already been pointed out by Paul and Jim, we have an epidemic of Ebola in Western Africa, and we had an epidemic of fear here in the United States. The Ebola epidemic is real, it's continuing. It's one of a series, what I want to know. Since 9/11, we've had one, I mean, obviously HIV/AIDS is before that, but we've had one after another. The world has been shaken and overshaken, and we're at, especially in the United States, we're on a pretty fine edge. So it doesn't take a lot to make us afraid. But Ebola was something special. I mean, I think it's real. It kills people. It kills a lot of people. It's scary because we don't have a drug or a vaccine for it. And it happened in a place that we don't know much about. And a place that's also very impoverished. It doesn't have, it actually doesn't have a healthcare system that's worth talking about at all. So the first question that the pandemic raised is, what should the world do about it? Should the world do anything about it? There is no, I don't have to tell you this, there is no world government. There is no world policeman. There is no world public health association. So it's a good question, is who's in charge here? Who should be in charge here? We do have an incredible group of NGOs, non-governmental organizations, of which Médecins Sans Frontières, Doctors Without Borders, has been far and away the most effective, hardworking, and dedicated group involved in the response to the Ebola epidemic. They've been on the ground at least since March of this year, and in the summertime, Dr. Joanna Liu, who's the head of the international part of Médecins Sans Frontières, started literally begging the World Health Organization to take over. Said, please come and take over. We can't handle it. We're just one non-governmental organization. Now, a really good one, a big one, but nonetheless, a private organization which has no authority, not the resources, not the personal power to do that. Although they did a terrific job setting up, actually they're called Ebola treatment units. We call them hospitals, right? To treat people with Ebola, which is very hard to do without getting infected yourself. In any event, the World Health Organization said, we know what they said, said, no, we can't help you. Not they didn't say we wouldn't help you, they said we can't help you. We have this great name, World Health Organization, and we are part of the United Nations. We have 194 countries, member nations, but actually, we're not an action group. We don't have the staff, money, or authority to take action. And the director of the World Health Organization, Dr. Margaret Chan, she said this, we're a technical assistance organization. The primary responsibility rests with the individual governments to respond, as if the individual governments have the resources to do so. The reason the rest of the world thought the World Health Organization would be ready to step in is because the World Health Organization has promulgated something called the International Health Regulation. That sounds pretty legal to me, the lawyer. The International Health Regulation, which among other things say that the WHO can declare a public health emergency of international concern. And they did so declare Ebola in August. It also says that the organization is based on a number of principles, the most important ones of which are human rights shall be fundamental to everything they do. They're a United Nations organization, so of course that's good. But the other one is dysfunctional, and it's a dysfunctional part of the world we live in. And you guys have to figure out, in your generation, how to change it. I mean, really. Is that the sovereign right of every nation shall be respected, cannot go, but that means you can't go into another country, no matter who you are, without that country's permission, because that country has sovereignty over their territory. And it really doesn't matter what's going on. There's only one exception to that. It's when the Security Council of the United Nations votes to say that that the UN is going to invade a country because it's putting the whole world at risk of a world war, basically. That'll basically never happen. For all practical purposes, state sovereignty makes it impossible to have an effective organization to respond quickly to pandemics or to epidemics before they become pandemics. So big problem, right? This is a reminder. Somebody must like Ghostbusters as much as I do. I love that movie. This is a scene you may remember with Sigourney Weaver and Bill Murray. Sigourney Weaver is trying to seduce Bill, and Bill says, you know, I make it a rule not to get involved with possessed people. And then he thinks about it for a while. He says, actually, maybe it's more like a guideline. Well, that turns out that's what the World Health Organization has, is guidelines, not rules. The WHO was right, though. There's 4 critical things we need in Ebola. We need leadership and coordination, information, technical expertise, and logistics. Unfortunately, they could only provide one, technical expertise. So we were left with, even though they didn't want us to be left with that, with back to Médecins Sans Frontières. And they're based on a totally different philosophy than the United Nations. Again, the United Nations is based on the philosophy every country is sovereign, independent, can't be breached. The founding philosophy of Doctors Without Borders is there shouldn't be any borders. There are no borders to compassion, there are no borders to illness, there's no borders to physicians and nurses helping sick people. We have, first they argue they have a right to interfere, and now they argue they have a duty to interfere, a duty to come to other countries and take care of people. Now, in real life, the world has changed. We used to have this thing called medical neutrality where people would honor doctors with their white coats or the Red Cross. Now they're targets on their back. Now they get killed. So they really can't go into other countries without the country's basic guarantee of their safety. But they still do better than any other organization. They're not the only ones. I mean, I've got a little word about Paul Farmer and Partners in Health, another terrific NGO. And Farmer made the point, as did his former colleague at Harvard, Jim Kim, who's now the president of the World Bank, that primarily what we're dealing with in West Africa is a problem of poverty. That none of this would have happened in a country with more resources and better healthcare system. And that it is absolutely unacceptable, morally, if not ethically, to just go in, help with the epidemic, and then go out and then leave again. That you have to try to build a sustainable, long-term primary healthcare system. And Paul has said that that's why he's there. Jim Kim is providing, as head of the World Bank, a unique situation. We've never had a physician, public health person, head of the World Bank before. But that's why the World Bank is taking a much bigger role here. Not as good as they should if you read the New York Times today, but good nonetheless. So how did the U.S. get involved? Again, you can't go to another country without an invitation. So the U.S. was invited to Liberia by the president of Liberia, right, Ellen Johnson Sirleaf, and she's also a winner of the Nobel Peace Prize. So her fellow Peace Prize winner, she essentially begged Obama, and she has, to come and help them, come and help. And Obama said we would, we thought we'd do that. He appeared in front of the United Nations about a month ago, and he gave 2 speeches, one to the National Security Council and one to the General Assembly. And in one, he argued that Ebola was a public health problem, a major public health problem, that the world had to respond to. Actually, I think that's true. In the other one, he argued that Ebola could also, and maybe more primarily, be seen as a national security problem for both the United States and for the rest of the world. And that's a little bit of a stretch, but the idea is that if Ebola breaks down the whole social structure of the country, more terrorist organizations could arise, and then the terrorist organizations could attack us. Again, a little bit of a stretch, but as anyone who's dealt in healthcare knows, Healthcare people love military metaphors. We always talk about fighting diseases on the front line, using heroic treatment, etc. So it's kind of natural for the president to look at Ebola as a potential invasion that we had to stop with our troops. So what did we send over? We sent over our military. We did. We sent in over 7,000 troops to build 17 new hospitals. This is a giant no-no in the NGO community, right? Troops generally breed conflict, bring conflict, kill people, and on the other hand, they can be used as a last resort if there's really nothing else you can do. And that's how they're seen. But I do want you to see, underline, that we have this extraordinarily weird situation from a public health perspective. We have an epidemic in one section of Western Africa. It happens to have borders. It happens to be 3 countries involved. But that has nothing to do with the epidemic. The epidemic doesn't know any borders, right? Across. Nonetheless, the response has all been country by country. The United States has responded exclusively in Liberia. The United Kingdom has responded in its old colony exclusively in Sierra Leone. And France has responded, even though you can argue Médecins Sans Frontières is a French organization, but France has responded in its own former colony in Guinea. So we have 3 responses, not coordinated by anyone. And again, if you read the Times this morning, you see even the response in the individual countries is not coordinated by anyone. So we have an uncoordinated response led primarily by soldiers who are not committed to have anything to do with sick people. So it's weird. The good news is there are United Nations organizations there, and the UN organizations, at least, as these countries that are involved, are pledged to follow basic major human rights documents, respect and protect the human rights of the individuals involved, not do research without informed consent, for example, and make sure that the human rights documents are followed. And that's good. That's good. We said that's good. On the other hand, we would like to, I think we would like, and I want you to think about this, how we could possibly do this, is to have a new rapid response organization that would be blessed by the United Nations before a new pandemic or threat. And that did have the authority to go into any country that had a pandemic and try to, an epidemic started, and try to stop it. It would have to not have any arms, obviously. It couldn't have anything to do with the military. It would have to be primarily physicians, nurses, healthcare workers, epidemiologists, anthropologists, I think, and would have to be funded by the UN. It could be, sounds a little strange, but it could even follow the rules of the Boy Scout oath. If you have any old Boy Scouts here, you'll know that a Scout not only is prepared, but a Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. You probably all knew that. What you didn't know is the first 6 are what we want from the rapid response team. This is what the people in Liberia want. We want a group that's trustworthy, loyal, helpful, friendly, courteous, and kind. And the last 6 is what the rapid response group wants from the people suffering from the epidemic. They want them to be obedient, cheerful, thrifty, brave, clean, and reverent. I don't know whether to laugh or cry, but I understand. So we have an ongoing, real ongoing epidemic in those countries in Western Africa. We're dealing with it, but not very well. We have no leadership and very little trust. And those are big problems. Those are 2 things you absolutely have to have in response to a potential epidemic. We may or may not. Well, I think we understand the leadership gap and the trust gap and the resources gap. The challenge now is to put together a credible, we thought we had a rapid response team, really. We thought the World Health Organization, that was their job. We know now we don't. So my initial response was, we got to get rid of the World Health Organization, come up with something totally new. I actually think that's going to be too hard. It's going to be much easier to try to reform the World Health Organization, make it into something that actually works and is responsive to people. And that's your challenge. All right, thank you very much.
I was always taught that when you're trying to formulate anything on a global scale, there's two things you need to consider: efficacy and feasibility. While an emergency task force composed of healthcare professionals would be efficient, do you think that in the current situation that is anywhere near feasible?
You know, it's, I actually do. I mean, maybe I'm a dreamer here, but I think the only two countries that would be against it, I mean, North Korea would be, but well, it would be probably China and Russia, right? And so, you know, maybe they could handle their own. I mean, I'd be even willing to have an exception for them, although SARS started in China, and we, you know, we didn't do a good job with that. But I think we've got to do it. I think that at some point, the world's going to recognize we got to deal with these things. These things are not political. We can turn them into politics, right? And they're not really military. Nobody's making a weapon out of this stuff. You know, people talk about it, but that's just silly. These are threats to humanity that can be dealt with. We know how to deal with them. We just lack the political will. But this is an opportunity. You have to see events like this as opportunity. Yep.
I don't know if this was necessarily related to international efforts, but I know at one point the U.S. created like an Ebola SAR.
We have an Ebola SAR, believe it or not. And nobody knows who he is and what he's doing. Right.
So I'm wondering what your thoughts are on.
I think that's the silliest damn thing I ever heard. I mean, it's interesting. Obama appointed him just when fear was peaking, and then after the election kind of went away. So we give the Ebola czar credit. He solved it. No, we don't need any Ebola czar. We need it's really too much. Let's send them over there. All right. That was an easy question, Eddie. One more, okay, yeah.
Yeah, just because you were talking about how each country does send aid and send soldiers in has kind of taken a territory, like, all right, we got Sierra Leone, we got.
That's right.
I feel
like a little sister, a little brother.
And since this is such a huge spread issue, I kind of feel like maybe splitting it up that way is good, but you were saying that if we had coordination, like what do you think coordination would help in terms of getting this?
Well, I mean, again, the virus itself has no idea whether it's in Guinea, Sierra Leone, or you know, Liberia, and doesn't care. Doesn't know boundaries. I mean, those are just very artificial things. Everything else crosses boundaries, including people. And it makes no sense from a scientific point of view, a medical point of view, a public health point of view, to look at this as territorial. Because it's not. It's not territorial. I mean, you can even see our response in the United States. Now, each state, although Texas did try at the beginning to do its own response, but it couldn't. You know, it had to wind up transferring patients to Atlanta and to Washington, D.C. And we had even this tiny little outbreak what we had here, we had to respond to a national level. I mean, that made sense. And you can do screening, you screen planes that come from all three of those countries. You don't just screen passengers and planes that come from one of them. You really need to do the same things in all three countries. It's kind of a waste of time and effort to try to reinvent the way you do it in each country separately. I mean, in real life, all three countries are more or less following the lead of Médecins Sans Frontières and building hospitals along their models and protecting suits along their models and cleaning places with bleach along. Okay.